Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips and Practical Tips. What I'm going to be sharing with you today is a nice example of a rare variant of urothelial carcinoma, the plasmacytoid variant. This is a case of a 64-year-old male patient who presented with hematuria, and this is the TURBT fragment of the fragments from the biopsy. And as you can see, there is diffuse infiltration of the piece, including invasion into the muscle and even into the perivesical fat by what appear to be individual tumor cells. And on high power magnification, as you can see, these are indeed individual tumor cells showing some eccentric nuclei, some acidophilic cytoplasm, giving the appearance of a plasma cell or a plasmacytoid cell appearance. And more, wherever you go, actually, the tumor is merely composed of this constituting cell type. Other areas show less of the plasmacytoid appearance, but again, mostly these are individual tumor cells, and there is some mucin or myxoidish background. And as you can see, some of the tumor cells have a vesicular nucleus and a prominent nucleolus. And in other areas, again, individual tumor cells with eccentric nucleus and acidophilic cytoplasm, abnormal, atypical mitotic activity. To me, this is very much reminiscent, actually, of lobular breast carcinoma, in particular, the pleomorphic lobular breast carcinoma. And this is one important differential diagnosis that we should keep in mind whenever we encounter such discohesive tumor cells infiltrating through the biopsy fragments in urothelial carcinoma. Now, importantly, in order to confirm the diagnosis, GATA3 is extremely important because GATA3 still is positive, diffusely positive in the tumor cells, and the GATA3 on higher power magnification showing positive nuclear staining of the tumor cells. Now, if the patient was a female patient, certainly we have to consider lobular carcinoma, although quite unlikely, but then we can do ER and PR, and this is really very helpful because most often ER, PR are positive in lobular carcinoma, whereas they are negative in urothelial carcinoma. But remember, our patient is a male patient, and lobular carcinomas usually do not occur in male patients. Now, importantly also, and again, similar to lobular carcinoma, E-cadherin is important to order because E-cadherin is completely negative in the tumor cells. There are perhaps some residual or some unusual tumor cells showing some positivity, some residual perhaps urothelium, but the vast majority of the tumor cells are completely negative. These are the two immunohistochemical markers that we usually utilize in order to render the diagnosis of the plasmacytoid variant of urothelial carcinoma, but also in order to exclude mimics or other differential diagnosis entities like lobular breast carcinoma, like gastric carcinoma, polycohesive, or even plasmacytoma or multiple myeloma. We have to do further stains, and in this case in particular, all other stains were completely negative, but apart from the GATA3 positive in nuclear staining and the E-cadherin negative result, a negative staining, which means a positive result. One important way in order to confirm that this is of urothelial origin is actually to look at other fragments, trying to see if there is an evidence of carcinoma in situ, and this was the case for our patients. So this is one of the fragments showing a disorganized growth of the surface urothelium with hyperchromasia, with disordered growth growth with loss of polarity. And even at this focus, there is what is known as the denuded urothelial carcinoma in situ, where because of discohesion, the carcinoma in situ cells start to fall apart, leaving only bare basement membrane or only occasional urothelial cells attached to the surface epithelium. So the final diagnosis in our patient is urothelial carcinoma plasmacytoid variant. This is a rare variant of urothelial carcinoma that you should be aware of in order to make sure not to misinterpret it as other types of tumors, and in order to render the proper diagnosis, because plasmacytoid variant of urothelial carcinoma is associated with poor outcome in comparison to the conventional type of urothelial carcinoma or even other variants of urothelial carcinoma. This particular variant has a tendency actually to sneak into the epithelium and even into the peritoneal surfaces. And this is one important cause for the poor outcome associated with this type of carcinoma. Remember, whenever you encounter such a variant, especially in cystectomy specimens, you have to pay extra attention, as we do exactly with the poorly cohesive or signet cell carcinoma of the stomach. When we look at the margins, you have to pay extra attention when you look at the ureteric margin, at the other margins, in order to make sure that there are not tumor cells versus inflammatory cells that we see. I have in the caption actually a very nice open access article that describes different variants, the morphology and immunohistochemistry of different variants of urothelial carcinoma, with one section dedicated for a plasmacytoid variant of urothelial carcinoma. I hope you find this tip useful in your daily practice. Thank you.